So what is the right answer when it comes to confirming patients' appointments? There's lots of options out there. I mean, when I started as an office manager, we didn't have a lot of options. We had the telephone. But now we have telephone, we have texting, we have email, we have companies that will confirm appointments for us. We have philosophies out there about just send them a card and that should be enough. We don't need to confirm them. There's so many theories out there that I see people going, well, what's the right one? What's the right one? Well, I have two answers for that. The first is what's right for your practice. You've got to make sure that you know the systems and have the policies written about what works for your practice. And it really depends. It depends on how big your practice is. How many people do you have to confirm? How many doctors do you have? What's your patient base? Are they very high tech or are they kind of low tech, right? So first you need to look at what's right for your practice. And what's right for your practice may not be what's right for my practice. So be careful of going out to the masses to ask for advice because it may not work for your practice. The second part of my answer is what's right for your patients, and every patient is different, right? So some patients, like my mom, if she writes in her calendar 6 months from now that she's got an appointment, she's going to show up. She doesn't need a confirmation. I mean, I'm still going to call and remind her of the appointment, but she really doesn't need it, right? But then my 18-year-old son, he needs an email, a phone call, an email, phone call, text, and then a text to say, get in the car and drive over. Your appointment's in a half an hour. Every patient is different. So we need to make sure that, yes, there should be a policy across the office. And yes, there are lots of great resources out there. But you need to figure out what works best for your practice and then what works best for your patients. And it's going to depend patient by patient. Not every patient is going to be confirmed the same way every time. So make sure you have the options that work best for your patient, because what is the ultimate goal of a confirmation call? Is it the call? Is it the reminder? Or is it to get the patient's #butts in the chair? Our job is to get the patient's butts in the chair. So if it means we need to offer multiple resources to do that, then that's what I suggest. So make sure that you're looking at all the options out there, but you're doing what's right for your practice and for your patients.